Mets on deck. Once again, Pete McCarthy.
And we're talking with Dr. John Gallucci right now, president of JAG Physical Therapy. Obviously, you don't have the MRIs, the charts, and all that information, but let us know a little bit more about rotator cuff strains in general. How much can the severity vary from case to case?
Well, as a physical therapist, athletic trainer, it's important to point out that the Mets have an absolutely great sports medicine staff that are definitively probably trying to treat this to care for the athlete the best way. And when you look at the rotator cuff, you've got four muscles that work together for the biomechanics of the shoulder for all the movements of a baseball player. So most probably the way they've listed it is that he has a strain and they're going to treat it day to day and kind of take him. But you can go as severe, and we see this throughout all athletics, possibly have a rotator cuff tear. One of those muscles can be torn. So everything is based on the individual that sustains the injury. It's very important to know that the rehab staff at the Mets is great, so I think he's going to get the best care.
Is it generally a quick healing injury? Is it something that can linger?
Well, we got to remember, in baseball, you're using your shoulder all the time.
Especially a catcher.
Exactly. So it's very, very important to stay conservative, really decrease the inflammation, decrease the pain, keep the joint motion and strength. And as long as everything starts to progress properly, there should be no reason why you can't get back on the field as the rehab team progresses.
Now, how much of it is about healing right now versus, rehabbing and trying to strengthen the area?
Well, the most important thing in any rehab is to decrease the pain and swelling and make sure the individual is comfortable. And then once you get to that point, to bring them back to some sort of strengthening and function. Of course, they're never going to put an athlete back on the field that they don't feel is ready. So I think it's important that they progress him, and when they feel he's ready to go back, they will.
Yeah, and do you see, rotator cuff issues in baseball often? I feel like, pitchers, when I was a kid, I saw, rotator cuff strain or something like that in the paper a lot. I don't see it as much now. Everyone focuses on the elbows and Tommy John. Have you noticed a difference, with the patients that you treat?
Well, it's interesting. We see a tremendous amount of youth, high school, and college baseball players and a lot of shoulder overhead athletes such as tennis and swimming. And rotator cuff injuries definitively are there, but you're seeing in throwers definitely more Tommy John. And the rationale is at your high school level and college level, you don't have the great medical staffs and biomechanical staffs and strength staffs that you do in the professionals. So ultimately what happens is children are thrown with poor biomechanics and ultimately get weakness in their shoulder and become elbow throwers, which ultimately leads to a Tommy John surgery. So we see this epidemic of Tommy John surgeries happening in the youth sports. I think if we really took a step back and took care of our youth athletes as well as we take care of our professional athletes, we definitively would have less surgeries overall.
Is that possible to take care of the little leaguers as much as we take care of the pros?
100%. JAG Physical Therapy, me and my staff do over 100 educational lectures a year for parents and children and coaches to decrease injuries across the paradigm of all sports. So definitively, there's always an opportunity of education and teaching the right biomechanics. As a physical therapist and a certified athletic trainer, it's so important that we each and every day watch our athletes and watch proper biomechanics, because as we know, even if you're not a professional athlete, if you're doing something incorrectly, you can hurt yourself. Look at how many people in America hurt their low back each and every day just by possibly going to get the wood to put in the fireplace.
And we're talking with Dr. John Gallucci right now, president of JAG Physical Therapy. Now you talk about being an elbow thrower. Are there certain things that you can notice that are warning signs, or maybe even certain symptoms that the player might feel if the elbow is starting to wear down a bit?
Well, usually you'll see in youth athletics that children will start to complain about their elbow in the medial aspect, starting to give pain. But most often what you'll see in the high school level is somebody will pick up that their biomechanics as a thrower is off. And if their biomechanics as a thrower is off, other muscles will compensate. And ultimately what happens is you become a poor thrower, because usually the posterior capsule muscles of your shoulder get weakened by poorly throwing, and then your elbow starts to take that strain. Also, we've looked at different range of motion capacities on external rotation, internal rotation, and literally poor flexibility can lead to elbow issues as well.
Do you think we know everything we need to know about elbows and how to avoid Tommy John, or is there still more that needs to be discovered, to really have a firm grasp on what's a huge issue, obviously, in Major League Baseball.
Well, I'm a physical therapist, athletic trainer for 25 years, and things are constantly evolving by great research through some great colleagues of mine throughout the country. So do we know everything? Well, as soon as we stop learning, then we shouldn't be a healthcare professional. So we got to continually learn. But I definitively think we have enough education to start to get throughout the college and the youth levels and the little league levels and the high school levels to truly mitigate the possibility of having these types of surgeries and having children so young have surgeries. Remember, they're not being paid to play. They're out there trying to have fun.
Yeah, and I remember when I was a kid, it was, don't throw a curveball until your growth plate comes in. And is that more myth now, or is there still a science to that, or is it more just about how many pitches and how long throughout the year so many of these youth pitchers are going?
Well, as we've learned tremendously over the last 10 years, it's about pitch count. It's about what type of velocity you're throwing at what age. It's about what are you doing as far as rotating. How can you teach a child how to throw a curveball if they really can't throw overhand yet? So when you're looking at the youth level, it's very important to teach the biomechanics of throwing and swinging. So this way you don't have any type of injuries and you decrease those injuries. And then secondly, you bring it to the component of truly advancing the athlete into learning the trick throws and the different things and making sure they're strong enough to handle it. But the biggest thing that we've learned from the professionals, which is outstanding, is pitch counts are important. And if you look now throughout all leagues, pitch counts are 100% helping decrease the incident of injury.
Yeah, pitch counts on a given night and then innings counts over the course of a calendar year. If you're a baseball fan now, you know all about that with how these young pitchers are handled. If you're a Mets fan, you've obviously seen plenty of it as well. And we're talking with John Gallucci right now, president of JAG Physical Therapy. Again, more information, jagpt.com. He's also the medical coordinator for Major League Soccer, where he oversees the health of over 500 pro soccer players. That's got to keep you pretty busy.
Keeps me busy. It's fantastic. But what it does do is it lets me get educated each and every day when it comes to soft tissue injuries. And as we know, soft tissue injuries are prevalent across the sports world, no matter if it's baseball, football, soccer. And we in soccer definitively have our soft tissue injuries. And we've been very, very fortunate to learn different ways to train our athletes to decrease those injuries overall.
Yeah, Yoenis Cespedes dealing with what we believe is a soft tissue injury, a bruised right leg from leaping into the stands a few weeks ago, and then he re-aggravated it this weekend against Atlanta. He's out of the lineup again tonight. Terry Collins said he might be able to pinch hit tonight. He could be back in the lineup as soon as tomorrow. We shall see. But I thought it was interesting that they say he has a lot of swelling and bruising, and he had fluid drained yesterday. Is that normal for, swelling? I mean, that's not how I would handle it, obviously, but I don't have access to,
Well, again, not being familiar with the case because it's not my patient, but ultimately sometimes you can have joint swelling or bursts of swelling, and it's not unusual for a physician to aspirate or reduce the size of the swelling in the area, especially if it's impeding in the joint or the function of the joint. So it's not an unusual thing for a physician to go into a swollen joint or a swollen bursa sac around the joint and decrease the inflammation by aspirating it and ultimately relieving that pain and swelling, and then it makes the function of the joint work better. And as we talked earlier in the show, it's all about biomechanics. And if you have poor biomechanics because of an injury or swelling, you're ultimately going to get compensatory patterns that can hurt something else.
Yeah, that's how one injury becomes another. You had the whole chain. You got to have you're as strong as your weakest link, that whole thing. But Dr. John Gallucci, pleasure having you on. We really appreciate you providing some insight to some of these latest Mets injuries.
Thank you so much. I greatly appreciate it.
And again, Dr. John Gallucci, president of JAG Physical Therapy, www.jagpt.com. So the